Thank you for the introduction, and let me also thank Alzheimer Europe for inviting young researchers such as myself to speak to you today. It's really an honor. As the title says, I'm going to be talking to you about the AMYPAD consortium, which stands for Amyloid Imaging to Prevent Alzheimer's Disease. And in that consortium, we focus on beta amyloid PET imaging to help improve our understanding, the diagnosis and management of Alzheimer's disease. So why do we focus on PET imaging? Well, I think throughout this conference and even before, you might have heard that the accumulation of amyloid plaques is one of the earliest, if not the earliest, detectable change that we can see in the path towards developing Alzheimer's dementia. And we can visualize this accumulation with PET imaging. In fact, this technique is already being used in clinical routine from some physicians, where they can apply this technique to better have a diagnosis, a timely diagnosis, and especially when excluding Alzheimer's disease as the underlying cause for the dementia. It's also being used already in clinical trials, where anti-amyloid trials use the technique to both recruit participants that harbor the pathology, but also to understand whether there's target engagement, which means they look at the images to see if their drug really is reducing the amyloid plaques. But this is all about what we're doing now, and the question here in AMYPAD is how can we use the technique for prevention? And the idea behind prevention using PET imaging is that in a disease that takes really decades to reach its endpoint, which is the dementia, the cognitive symptoms, the idea of prevention is really going as early as possible, and we really believe that this is the target we should be looking at, which is the accumulation of amyloid plaques, one of the earliest pathological hallmarks of Alzheimer's disease. And we're going to do this with PET imaging because we understand that this is a technique that allows us to look at the brain very accurately in a quantitative manner to understand how much and where these amyloid plaques are. In fact, this idea of a biomarker-based prevention is already ongoing. I'm sure all of you are very much aware there are already clinical trials that have observed a reduction in amyloid plaques in the brain, but unfortunately they have not observed also an amelioration of symptoms. However, we believe that we are just looking at the wrong population here, and we have to go earlier in the disease process. And we are hopeful, because if we manage to see this effect in an earlier population, this means that one day in the clinic we can diagnose the disease to prevent the dementia. So how is AMYPAD trying to, join the race towards a preventive measure, and how are we trying to bridge some gaps here and there and bring some knowledge to the field? Well, we've developed two clinical studies, one looking at the diagnostic value of the technique and the other looking at the prognostic value. So the first one is really trying to understand how this technique can be used in the clinic. So is it useful for physicians to know the amyloid status based on PET imaging? For which patients is this useful? And is it cost effective, which is a very important question if we're ever going to discuss with regulators and with payers the reimbursement of this technique. The second study, which is the prognostic and natural history study, is actually linked to EPAD, which you might have heard of as well before. In EPAD, they are already assessing a lot of subjects in a pre-symptomatic phase of Alzheimer's disease to understand lots of risk factors that later on will lead to developing Alzheimer's dementia. And what we're doing is we are including amyloid PET into a subset of these participants to better understand the natural history of Alzheimer's disease, and together with EPAD, help enrich and empower secondary preventive trials. In total, in AMYPAD, we're going to have 2,900 subjects included over the two studies, and a total of 4,200 scans, which I want to stress out, they're going to be made available to the research community. And therefore, the study impact is not only in the results that we're going to get, but also in future research. So I'm going to tell you very quickly about the diagnostic study, which is looking at the clinical utility of amyloid PET. And I'm sure some of you are aware that there are other studies already looking at this question. And we can mention two great studies here. First is the IDEA study, which happened in the US, where they found that after providing amyloid PET scans to patients, there was a change in management of 67% of MCI patients and 66% of patients with dementia. And in addition to this, they also found that after using the technique to look at the biomarkers, there was a 10% reduction in the need of other assessments for these patients. There's also the AMYPAD study, which took place in the Netherlands, where I am working on. And there they saw also the value of this technique for changing diagnosis, where across diagnostic groups, there was a 25% change in diagnosis after knowing the results of the amyloid PET. We believe we can go further with our study, and so we designed a randomized trial with 3 arms. So the first arm, patients are going to be subjected to the amyloid PET imaging technique early in the diagnostic process, within 4 weeks of their baseline. The second arm, they will only be undergoing amyloid PET scans later in the process, after they've already had all of the other assessments. And the third arm is a free arm. The physician is free to choose if and when they want to have this technique available to understand the biomarker status of those patients. And so this third arm will allow us to understand for who and when this technique is valuable, while the first 2 arms is going to allow us to understand if having amyloid PET available early in the diagnostic process helps physicians reach a diagnosis with a higher confidence. We're also looking at outcomes in patient management, healthcare resource utilization, and patient-related outcomes. Now, in the prognostic and natural history study, we're moving away from this diagnostic use of the technique, where we can see the value of PET for differential diagnosis and early diagnosis, and we're really going to be using it as a risk profiling measure, together with EPAD. So as I said before, this study is really linked to EPAD, where participants are already undergoing a longitudinal cohort study, and they are being assessed year after year in several ways, looking at several risk factors. What we're going to do is select a subpopulation of those subjects and provide them with amyloid PET scanning longitudinally. So we were going to be able to see where and how fast amyloid is accumulating in this preclinical population. And when we join this information with what EPAD is already collecting, we're going to be able to determine a risk of progression to Alzheimer's disease dementia, individualize that risk, and then hopefully also support the preventive trials that are ongoing and future ones as well. So if you noticed, I've been talking about AMYPAD in the future tense, but actually AMYPAD is already a reality today. And I'm going to tell you what we've been doing so far. We've been delivering from the get-go. And one of the first things that we did, even before our studies have started, was to develop a new protocol for imaging the brain. Usually, with the tracers that we use to do PET imaging, a patient or participant has to lie in the scanner for up to 2 hours, which is really, really long and unacceptable. So what we did was we developed a protocol that puts a gap in these 2 hours, providing a rest to the patient or participant, and also allowing us to scan a second patient or participant in that gap. So it's also cost-effective for us. We've also been very busy connecting with existing initiatives and studies, and we've collected an enormous amount of data to reuse it, because there is a lot of data available already on amyloid PET imaging. So we've collected more than 5,000 scans, actually. And with these scans, we were already able to look at what are the earliest regions to accumulate amyloid in the brain. And it seems that we can stage subjects or stage their accumulation process in 4 different steps. And these steps actually have a different risk of cognitive decline. So it seems from all of this data that having just a little bit of amyloid in the brain is very different from having no pathology at all. And this is going to help us identify subjects earlier in their process, but also hopefully support preventive trials by linking the amyloid deposition to risk of future cognitive decline. And we also have our studies, and they are ongoing. So the Diagnostic Study is sponsored by the University of Geneva. And actually, these numbers are outdated because it goes so fast. We now have 66 patients randomized and 21 scanned. And there's only 3 sites recruiting, so imagine what we can do when the other 5 come on board before spring. And the second study, the Prognostic Study, is sponsored by the VMC, which is where I come from. And we are the only ones recruiting so far. We started less than a month ago. And we already have 6 participants included and 1 scanned. and there are going to be 10 more sites joining us before summer next year. And before I leave you with this very brief and comprehensive view of the AMYPAD consortium, I also want to tell you that all of that we're doing is not just for researchers, it's really to the patients and to the participants. And so we already designed 2 additional sub-studies to understand the biomarker disclosure process and its impact on both patients and participants. So with that, I would like to thank the AMYPAD team for their amazing work. Thank you, Alzheimer Europe, for letting me speak here today, and thank you for your attention.